Good afternoon. I'm Delaware County Council Chair, Dr. Monica Taylor. Thank you all for joining us today virtually, and to our expert guests from the American Heart Association, the Delaware County Health Department, and Dr. June Elcock Messam. We're grateful to have you on board to share your knowledge about heart health. Today, residents will hear from our panelists about the importance of cardiovascular health statistics in our country and about the life-saving results of CPR and CPR disparities. Sadly, cardiovascular disease is the leading cause of death in the United States, accounting for 1 in 3 deaths across the country. But the good news is that there are ways we can prevent it. The American Heart Association has been leading the fight against heart disease through education, awareness, and medical research. In 1964, they began the first American Heart Month to raise awareness and increase education. This year's theme for National Heart Health Month is Be the Beat, with the goal of increasing the knowledge and the awareness of the use of life-saving CPR. The Delaware County Health Department has partnered with the American Heart Association to hold this virtual webinar to educate residents on the importance of heart health and CPR. Thank you to the American Heart Association for your passion and dedication surrounding the heart health of our residents and to our health department team. I'd also like to thank and recognize one of our guests today, Dr. June Elcock Messam. In recognition of Black History Month, the Delaware County Health Department has been recognizing a Delaware County Black public health pioneer each Thursday in February. Each Thursday, the Health Department details the careers and accomplishments of selected Delaware County Black public health community members and showcases how their work has benefited community health for the residents of Delaware County. Dr. Messam was named one of Delaware County Black public health pioneers. Dr. Messam has been a leader and champion for public health in Delaware County for so many years, and she has been such an amazing support to our county. Congratulations, Dr. Messam, on this much-deserved recognition. I am hopeful that with the leadership on this webinar and the investment in health from the residents who are watching, that we can greatly improve health outcomes in our community. Thank you, everyone.
Thank you.
Thanks, Dr. Taylor. Jacob Zichik of the American Heart Association is up next.
Hi, I'll just want to make sure that you could see my screen.
We can see it. Thank you.
Terrific. Well, my name is Jake Zichik. I'm with the American Heart Association, and this February is Heart Month. And really today we're talking about addressing health equity and CPR disparities in Delaware County. For those unfamiliar with the American Heart Association and American Stroke Association is not just a charity. We are crusaders, innovators, scientists, and community partners, with really our mission being to be a relentless force for a world of longer, healthier lives. And with our focus really being on our 2024 impact goal as really championing health equity, and I'll speak a little bit more about the strategies that we are doing to accomplish that goal. But that's really where our kind of multi-year focus has been around a 2024 impact goal, really championing health equity, removing barriers to healthcare access, and improving the quality of care that everyone receives. As you can see on this chart here, we kind of focus this in many different aspects, and just want to highlight a few of the work that we're doing in Delaware County and kind of what we consider the greater Philadelphia region. As you see, Go Red for Women is really our kind of education and awareness campaign around reducing the risk for women. And we do a great job at that in the event, but we still have a lot of work that needs to be done. We also focus on tobacco, e-cigarette, and vaping use. And some of the work that we've done around that is around our national campaign for the tobacco endgame, with really engaging and advocating with youth advocates at the high school and college level. We also work closely with school districts around vaping and tobacco policies and ensuring that cessation and education resources are available for youth. We also focus on controlling blood pressure. Part of the work we do that is with our clinical partners around Target BP and also in innovative settings to provide self-monitored blood pressure cuffs, including in libraries and community partnerships. And then around healthy living and improving nutrition and security, we work with community partners like Share Food Program, the Food Trust, and Phil Abundance around nutrition standards, and school wellness policies in both the school and the early childhood settings. But lastly, I want to kind of focus a little bit around addressing community need, which is improving our hands-only CPR bystander rates and ensuring that there's awareness and education on the importance of that. And so later today, we'll show a video and kind of share why it's so important to know hands-only CPR. But a lot of our focus has been around addressing community need and improving the knowledge and kind of education and awareness around hands-only CPR. We have worked with the state at the state level to ensure that all high school seniors before graduation receive hands-only CPR training, and that has now been fully funded at the state level. And we are working with community partners around kind of their awareness and response plans for CPR at the community level. And as you can see, and kind of as I alluded to, a lot of our work is done in different settings, whether that is in the school setting around tobacco and CPR and even nutrition, the clinical setting, the faith-based leader and faith institution setting, really you name it, we are kind of out in the community and meeting people where they are at to have these conversations and, start to really, try to move the needle and address health equity and the disparities that we see. And just want to acknowledge once again that February is American Heart Month. Our focus is to be the beat around hands-only CPR training, and we'll talk about that in a little bit. But of course, there's 2 steps to save a life. The first one is to call 911, and then to immediately push hard and fast on the center of the chest. We'll talk a little bit more about that later. But wanted to thank everyone for joining the webinar today, and wish everyone a happy American Heart Month.
Thanks, Jacob. Next up is Dr. Victor Ruan. Victor, if you're ready, you have the floor.
All right. Thank you very much. I'm going to begin to share my screen. I hope you can see the Delaware County Health Department logo. And thank you for the opportunity. I will be talking about some statistics. I will be talking also about risk factors and what these are. And also at the end, I have a slide of the common numbers that we should be aware of regarding how to protect ourselves from heart disease. Let's see if I can begin with I thought it would be good to include the leading risk factors for heart disease in the United States and definitely in Delaware County. Risk factors, as you might be aware, are things that we can do or not do that will increase the likelihood of developing a disease or a condition. So when we look at risk factors, if we identify risk factors, we can then interfere with the progression of a disease. We can also reverse the disease in some cases. So the leading risk factors for heart disease in the United States are high blood pressure, high blood cholesterol or lipids, and smoking. Those are the key risk factors. Other medical conditions and lifestyle choices that can also put individuals at higher risk to develop heart disease or complications for heart disease includes a diagnosis of diabetes or increased uncontrolled blood sugar, overweight and obesity, usually a BMI over 30, unhealthy diet and physical activity, and excessive alcohol use. All of these risk factors are modifiable. We can learn about these risk factors. We can learn how to control the risk factors with a number of intervention and strategies. For example, medication to control high blood pressure and high cholesterol. Also, when we talk about diabetes, as well as heart diseases, we can work with our environments, including what we eat and how much physical activity we actually are engaged every week. Let's move to the next slide. These are the leading causes of death in Delaware County in 2020. And the first one, as you can see, the largest bar, is heart disease, second by cancer. And you might be wondering, where is COVID? COVID is on the third one, with in 2020 about 1,030 deaths for Delaware County. So these are the leading causes of death. And I would like to also say that all of the information presented today it originated from the Department of Health, the Pennsylvania Department of Health databases. Now let's look at cardiovascular diseases. The slide here shows two very important messages. Cardiovascular diseases, we're talking about stroke, we're talking about clots, we're talking about when there's a blockage in the blood vessel, and also when the blood vessel ruptures, aneurysms. Now, age-adjusted, what it means is that we are able to compare persons of different ages. Why? Because with age, we also have an increased risk of developing certain diseases. So what is the message here in this? You're going to see these dotted lines, one going up, the other one going down. What the data is telling us is that among African Americans, Black or African Americans, there is an increasing trend in cardiovascular diseases related death between 2016 and 2020. And the opposite is true for white populations. So we can see here a significant difference, increasing trends, decreasing trends regarding cardiovascular diseases. Let's look at heart diseases in general. And again, we're using age-adjusted heart diseases death rates. Death rates or rates allows us to compare also across populations, but also across counties and states. So what are we looking here? It's very telling. In this slide, you're going to see two major significant messages. One is that from 2012 to 2020, male and female white and Asian Pacific Islander age-adjusted death rate decrease. However, for male and female Black or African American increase. Again, showing this difference. So you can see the second group of bars, male African American going up from the blue to the orange, which means the blue is 2012 to 2016, the orange 2016 to 20. So over time, we look over time what is happening, increases, decreases of diseases, and we use rates to properly measure diseases across populations and geographical locations. Now let's move to the next slide. We're talking about hypertensive age-adjusted. This is high blood pressure related age-adjusted heart disease death rate. And again, we're going to see here some significant messages. Between 2012 to 2020, male and female Black and or African American age-adjusted hypertensive disease death rate increased. Female Black or African American decrease. It's a significant difference here. So it increased for all the other groups except for this. However, when we look at the numbers, let's say the 8 compared to 15 or 9 compared to 21.6, we can tell that among male Black or African Americans, the death rates were twice as higher than for white during the 2012, 2016, and 2016 to 2020. So these are statistics, and behind all of these numbers, of course, we cannot see, but there is the anguish, the sorrow of losing one person from the family, friend, or again, companion. Now let's look at diabetes, age-adjusted heart disease death rate. Now, this diabetes it's a significant risk factor for heart disease and many other conditions because of the inflammatory pathways. So when we look at diabetes, death related to diabetes, we're looking at 2012 to 2020, male and female, white and Black or African American age-adjusted diabetes death rates decrease. Again, we're looking at male and female Black or African American rates were higher than male and female white rates. So we see these discrepancies again showing in the numbers again. Male white for 2012 to 2016, the blue bar, 17.9, that's the rate per 100,000. And when we look at male African Americans, same time, the blue bar, we look at 42, a significant difference in death rate with diabetes. Now let's quickly talk about smoking. Smoking is a very important risk factor for heart disease. According to statistics from the National Institute of Health, about 12% of the county population in Delaware County are current smokers, 2021 data. Smoking is a major risk factor for heart disease, as I mentioned before. And how is this working against us? Because the chemicals involved when smoking damage the inner cell walls of the blood vessels, making them inflamed with plaque that limits the flow of blood and oxygen to vital tissues. Sometimes this plaque buildup breaks and creates clots, and we have severe muscle damage in the heart and other places in our system. Any amount of smoking, even occasional smoking, can cause damage to the heart and blood vessels. Important information that we need to share with our patients and residents. Smoking has a greater risk for some individuals, especially if you're on birth control pills or have diabetes. And smokers with other heart disease risk factors, for example, if you're a smoker and also you don't really are concerned very much, or you cannot control the type of food that you eat, or the amount of cholesterol, you're not aware of your cholesterol numbers, you're not aware how can you reduce the numbers. If you have high blood pressure and not taking medication, or not aware that you have high blood pressure, and overweight and obesity, all of these things, risk factors, plus smoking, increases your risk of heart disease. And then secondhand smoke and third-hand smoke are very also causing problems with heart disease and many other conditions. Also to mention that just because you have, let's say, a condition, you develop heart disease, some type of condition, high blood pressure, or some type of coronary disease, there are ways that you can stop the progression of the disease with medication, proper care, and behavioral changes, the way you eat, the way you exercise, your mobility, and so forth. These are the references. And the last slide is just general information. As you can tell, you might want to be aware of the total cholesterol between 125 and 200. And the other one that you need to be particularly aware is the LDL, less than 100 milligrams. So the message here, know your numbers, talk with your physician, with your primary care provider. Sometimes things happen. You might not be called for an appointment to check your blood levels on a frequency basis. So you pick up the phone and you call them, you make the appointment. I want to know about my numbers. I want to know about my sugar levels. Of course, they take your vital signs every time you go to the office, but these numbers are very important. It would help us guide through our life and make choices that can help to either prevent or reduce the disease progression, and sometimes reverse the diseases that are afflicting us. I think I will stop sharing right now.
All right, you're all set, Victor?
I am.
Great. We have Jacob Zichik from the American Heart Association, who will discuss CPR and CPR disparities next. Jacob, you have the floor. If you're talking, Jacob, you might be muted.
Terrific. Glad to be back and talk a little bit about hands-only CPR. Before I start, I just want to thank Dr. Taylor from the Delaware County Council, the Delaware County Health Department, and really everyone at the county level and county council in Delaware County for their equity first commitment throughout the county and this county services, and then also for the work that they're doing to address public health and improve health outcomes. So from the American Heart Association, I know, just want to say thank you, and also wanted to say we look forward obviously to this webinar, but the work that we can do moving forward too. For February, this Heart Month, our focus is around Be the Beat, and really to engage with the community level around the importance of hands-only CPR rates. Here you'll see a little bit of a fact sheet, and I know that this fact sheet, I believe, is at the Delaware County, the Wellness Center, and being circulated all throughout the community, not just in Delaware County, but across kind of the nation. So we're really excited about that. And really one of the kind of keys that we really are kind of honing into is that there's about 350 to 100,000 annually of cardiac arrests that happen outside of the hospital, with about 70% of those happening in the home and about 20% of those happening in public spaces. So as you learn hands-only CPR, there's a very good chance that this will happen to someone that is a loved one or someone that you care for. So it could happen to a friend, a family member, or someone that you're close with. And so there's a very good chance that this could potentially happen at home. And really only about 40% of folks that receive have a out-of-hospital cardiac arrest receive immediate help. And so we're definitely looking to improve those numbers really in Delaware County, but across the nation. And these are our national numbers, but really at most local areas, we've seen kind of them follow trend lines. One of the concerns that also we have is around 911 response rates. And so those greatly vary, those disparities, depending on certain communities. We've also seen individuals, depending on race, ethnicity, and gender, receive different response rates around hands-only CPR too. So we're definitely looking to improve really across the board those disparities and kind of the quickness and response rates also. I have a quick video to show everyone, and it really will highlight the steps on hands-only CPR. I just wanted to acknowledge that this is not a CPR certification. Those are provided by great organizations in Delaware County and really across the nation. But this is really just about a kind of quick response hands-only CPR. So I will click right here, the video. Sorry about that. Hopefully everyone was able to see the video well, and we can make sure to kind of continue to share that around. There actually is multiple videos, including extended versions that highlight AED kind of awareness also. But as we kind of discussed a little bit about hands-only CPR, I did want to highlight a few kind of important key factors to this and kind of answer some questions that we do generally receive. One of the things is that there's a very good chance, unlike this animated video, that when this happens, the person will not be just laying down flat on the ground. And so we do, you do need to get them to a hard surface and lay them down in that regard. So there's a very good chance, unlike the video, that they would not be like that, specifically if you're imagining a home, maybe on a couch or a chair. And so that you need to have them on a hard, flat surface. The other key to this, I would say, is really the emergency response of calling 911. So immediately, if you're in your home, you want to call 911. But if you are in a public setting, and these about 20% out of the hospital happen at a public setting, like an airport or mall, etc., is really you will need to point to someone specifically, either if you know them or what they're wearing or an identifier, their shirt color, something like that, and be very specific around call 911 and get an AED. So if you're with someone, you need to really be specific in that crowded setting. Research has shown that if you just kind of say it blankly, no one will actually go get that. We do receive quite a bit of questions about AEDs. And just wanted to say around AEDs, they are pretty kind of self-explanatory once they are kind of started and activated. And so part of the video series that we do have does have information around AEDs, but we have not seen as many concerns or issues of people utilizing AEDs. It tends to be more around facilities having them compared to kind of usage in that regard. In addition to that, we do get some questions around kind of the compressions and kind of starting compressions. And research has shown, I know in the past there was some information around kind of using your mouth and things of that nature, but newer research has shown really the importance of jumping in and starting compressions about as immediately as possible. And as you saw from the video, making sure that you do not stop over for 10 seconds. One of the questions that then comes up is it does in some cases take emergency, services in response you could take minutes. We have seen some disparities across that in different communities for various different reasons. If there is someone else who knows hands-only CPR in a setting with you, you can kind of tag that person in, so to say, to kind of continue the compressions. And so those are some of the kind of the key parts and kind of takeaways that we really wanted to share and some of the questions that we generally receive when it comes to this type of work. It is around about 1 to 2 inches closer to, on the compression level, and I believe it's around 100 to 120 beats per BPM, I believe, per, that. And that's around the song Staying Alive also. And there is actually on Spotify a channel around CPR and CPR training. If we were doing this in person, we would, turn that on so you can kind of see the pace of which this happens. If you talk to individuals who have jumped in and done hands-only CPR, it can be very tiring. It can be exhausting at times, but obviously it's so important because you can be a lifesaver. And we have, hundreds, if not thousands of stories of survivors in many different settings, from the woods, hunting, to malls, to airports, that the importance of hands-only CPR. And I know many of us saw during the NFL game the importance of hands-only and CPR and the AEDs in that football game. So just want to kind of highlight some of those important kind of best practices and tidbits that go along with this video. As I change the slide super quick, there was one other question we do get quite a bit, and it is a fear of people jumping in and starting hands-only CPR. There are Good Samaritan laws, and so there should be no concern around that if, and you're using hands-only CPR, you do crack a rib or something of that nature. They're Good Samaritan laws, and obviously saving someone's life is just so much, more important. Whoops. Apologize about that. And so really, as we go across, Delaware County and the whole kind of region, and really Pennsylvania and across the country, we're really just kind of highlighting, 2 very, very important steps here. The first one being to immediately call 911 and, get that kind of emergency response. And then the second component to that being to push hard and fast in the center of the chest and begin those compressions. So as we travel across the country and talking to community groups, those are really the 2 kind of keys for us. primary takeaways, along with everything else that we hopefully shared too, in the importance. I just wanted to highlight a few other things we are working to improve CPR rates. Pennsylvania did join, I believe at the now it's over 40 states to ensure that all high school graduates receive their graduation diploma, receive hands-only CPR training. That's part of kind of, increasing the amount of individuals who are familiar with CPR. And, we're very excited about that. And it is now fully funded in previously Governor Wolf's budget, and we believe moving forward in the future budgets also, so that school districts don't have to allocate money or resources from other important programs. It can come in from these programs. And so that will just kind of continue to increase the amount of potential bystanders who can jump in and do CPR. We also are working closely with governments, private, settings, businesses, schools, universities, et cetera, on some of their kind of immediate response, kind of community response plans around ensuring that their staff are familiar with CPR, AED awareness, and other components to that. So that wraps up, my part of the presentation today. I just want to thank everyone once again for joining the webinar. And, just say that, at the American Heart Association, we're very excited to continue our partnership in Delaware County and work with, community partners, and stakeholders to really highlight the importance of hands-only CPR, but also some of the other work that we're doing, whether it's around controlling blood pressure, addressing nutrition insecurity, women's health, and so much more. So once again, want to thank everyone and really thank everyone at the Delaware County Health Department who are kind of, on the ground doing this work every single day. So a huge thank you from us to everyone in Delaware County.
Thanks, Jacob, and a big thank you right back at you at the American Heart Association. Thanks for joining us. Next, we have Dr. James Plummer from Population Health Division of the Delaware County Health Department. Dr. Plummer, you have the floor.
Thank you, Matt. Matt, back in January, the Delaware County Health Department team knew we wanted to do something to recognize the many Black pioneers of public health that are working in Delaware County. I, for one, immediately thought of our next speaker, Dr. June Ilcock-Messon. I am honored and privileged to work alongside Dr. June, as I affectionately call her, in her role as president of the Delaware County Medical Society. But people need to know that Dr. Ilcock-Messon is a highly decorated physician and lifelong hero for children and pediatric medicine. She's the founder of Every Child Counts, a nonprofit that provides aftercare for at-risk youth. And she organized many, many COVID vaccine clinics during the COVID outbreak. So it is my honor to really recognize a true pioneer in Delaware County, Dr. June Ilcock-Messon.
Thank you so much, Dr. Plummer. Thank you so much to you and everyone at the Department of Health, to Dr. Monica Taylor. It is just a pleasure to work with each and every one of you. And thank you for inviting me to be part of this event. On behalf of the Delaware County Medical Society, I just wanted to briefly make some comments about the importance of heart health. I am the daughter of two amazing parents who both died from cardiovascular disease, and fully recognize that we are a statistic, as you saw from our previous speakers. I don't want to repeat anything that they have, but I wanted to say that according to the American Heart Association, on average, someone dies from cardiovascular disease in the United States every 34 seconds. That means that by the end of this, there will be, our webinar, there will be many deaths in the United States. We have a real opportunity for prevention because most of cardiovascular related diseases are lifestyle related. If you are obese, if you have high blood pressure, if you have high cholesterol, the bad type, if you're a smoker or being exposed to smoking, if you have an unhealthy diet, if you're living a sedentary lifestyle, meaning you're not very active, you're losing opportunities to protect your heart. Please talk to your doctors about it. Since most heart attacks happen at home, just like the last speaker just said. It's important that you understand some of the symptoms. And as a Black female, I can tell you that sometimes our symptoms of heart attack are different than other symptoms of other people's. So you can have chest pain. Everyone knows that that's a common symptom of heart attacks. However, it can be described in different ways by different people. So a tightness, squeezing, pressure, but you can also have pain on the back, the shoulders, the arms, the neck, the jaw. You won't have just likely not that isolated symptoms, but you can have unusual shortness of breath. So for instance, if I go to run a mile now, I will be breathing heavily at the end of it. I'm going to be sweating. My heart is going to be racing, but that's not because I'm having a heart attack. I'm just out of shape. So I'm talking about a different type of shortness of breath. When you walk up the stairs, if you get to the top of the stairs and all of a sudden you're short of breath, you're sweating, your heart is racing, please call your doctor. Some of the symptoms of a heart attack can include nausea, indigestion. In the Caribbean population, we would absolutely just say, take some Tums. We would drink something, think it's heartburn. Don't ignore nausea and indigestion if you have new onset shortness of breath, sweating, palpitations. Some patients also report dizziness and fatigue. I just want to say one more time, women present differently than men and may not have chest pain at all. Please, if you're having unusual symptoms and multiple symptoms of fatigue, sweating, shortness of breath, heart palpitations, please call your doctor. Both of my parents had heart attacks and we did not know that they had heart attacks. If you're worried that you're having a heart attack, I don't want you to go to an urgent care. I want you to go to the hospital. The quicker that you intervene, the more likely your life will be saved. If you're prescribed medications to protect your heart, please use your medication as prescribed. You should remember to have your blood pressure screenings often, especially if you have high risk factors. If you do not have a doctor, if you're having difficulty getting hold of your doctor, please, the Department of Health is located in Yeadon and you will always be welcome. Thank you so much to the Department of Health for this opportunity to speak to you and for all the work that they're doing in the county to improve and enhance the lives of our Delco residents. Thank you so much.
Thank you, Dr. Alcock-Messam, and congratulations again. Thank you for doing what you do. Reading your bio and putting together your recognition was an honor. So thank you.
Thank you.
Next up on our agenda, we have a Q&A section. I don't see any submitted so far from our attendees, but if you'd like to ask a question, you can use the raise your hand function as well. So I'll give you a few moments if you have any questions to raise your hand. Okay, I see Janet Watson. Janet, go ahead. You can unmute yourself.
Yes, I had trouble connecting into today's Zoom program to this webinar, and I'm wondering if it's being recorded, if I could watch the beginning of it since I just got connected.
Oh, sorry about that, Jen. Yes, it is being recorded, and I believe we have your email you used to sign up on file, so we will get that recording to you.
Oh, great. Thank you so much.
You're welcome. Any other questions from attendees? Okay, going once, going twice. Next up on our agenda, we have Health Director Melissa Lyon, who will conclude today's webinar for us. Melissa, you have the floor.
Thank you, Matt, and thank you to all of the panelists. I really want to thank you for making time to be with us here today, as well as our participants. We're trying to make an effort to create a more health conscious and informed community, and you are all the start of that information and creation. Thank you to the American Heart Association and Dr. Taylor, Dr. June Alcock-Messam, and everyone who helped make today possible. I want to thank all of you who felt that heart health was important enough to register and spend time with us this afternoon. It is disheartening to learn about disparities in our areas like CPR and heart health. But if I have learned anything in the past hour, is that there are folks in the community who do care and are working to be part of the change we need. I love public health, and I love talking with residents like yourselves and partners like the American Heart Association about how we can come together and help create a healthier future for Delaware County. I've learned something from today's webinar as well. For example, the idea that 3 out of 4 cardiac arrests happen in the home. Well, I suppose I shouldn't have been surprised about that statistic. I am surprised about that statistic, which also recognizes that every one of us should be learning how to do hands-only CPR. The conclusion of this webinar also brings to the conclusion of our planned Black History Month recognition and events. But that does not mean that we are done reaching out to the Black community and working to improve health in our neighborhoods. As Dr. Plummer says, Dr. June, as you have heard from, was our last Delaware County Black public health pioneer. We also held blood pressure screenings and CPR hands-on trainings. And it is our hope that through these initiatives, at least one life will have been touched or even saved. Yes, this is the end of our planned efforts in February, but it is not the end of our mission to improve public health across Delaware County. In the coming weeks and months, we will be announcing more opportunities to improve your health, and our community centers in Yeadon and Chester will be open year-round because we are here for you and because of you. Thank you so much and have a great afternoon.
Thank you, Melissa. And with that, that will conclude our webinar. Thank you, everybody, for attending and all of our panelists for joining today. Have a nice afternoon.